Okay, I just got home yesterday from having mitral valve repair, and I wanted to go over what I brought in my bag with me to the hospital. And I packed this bag like a week ahead of time. I just had a bag open, and anytime I could think of something new that I would want to bring, I put it in the bag. And then those next few days, like I packed my deodorant. So when I needed to use my deodorant the next day before surgery, when I was still home, I would just grab it out of my bag, use it, put it back in the bag. Um, so I would know I had everything packed. Um, some things I found on a list online from other people, but this is what I ended up bringing. Um, the doctor's office told me to wear comfortable clothes in, just come in your pajamas. Excuse me, because they're going to be completely clean. For open heart surgery, you have to like disinfect your body and then put on clean pajamas. So you wear those in, um, and then you can also wear them when you leave. Just bring some new underwear, um, and that's one less thing you have to pack. So you don't have to think about your going home clothes to pack. However, when I was leaving the hospital, we were gonna stop and get lunch, and I kind of didn't want to stop because I was in my pajamas. So we ended up going through a drive-through or something. And I don't know why it bothered me because I don't question when people wear pajamas. I think I worry too much what people think. But around where I live, people like talk down about people that wear pajamas out in public, like they don't have the time to put some clothes on or they're lazy or whatever. So stupid as it is, I felt uncomfortable going into a restaurant with my soft, fuzzy fleece plaid pajama pants. Um, I know I shouldn't have, but I did. So if you do think you might want to stop somewhere on the way home, go ahead and pack, I don't know, loose pants. Scrub pants are great. You can get khaki scrub pants with the elastic waist that they look like dress pants, and they're really nice. Um, I brought my own pillow, and I'm glad I did because the hospital room gave me two pillows, and they were very, very firm. And all throughout the day, it's just so hard to get comfortable. You got these tubes in your chest, and it's hard to breathe, and it's hard to sit in certain positions. And they make you get out of bed, they make you sit up in a chair. And when you sit in the chair, like the hospital I was at, they put the pillow behind me, and I just felt like it was pushing me forward all the time. And I ended up realizing that the chair was better without any pillows behind me. So I don't know why they kept feeling the need to put pillows up behind me. Um, I really don't. And then when I kind of reclined in the chair, having my own pillow, and even in the bed, having my own pillow to sleep on made such a difference. You have your pillow at home that you like because you sleep well with that pillow, so bring it. Just, make sure you have a fresh pillowcase on it because you have to sanitize your body and everything has to be clean because you don't want to get an infection. But I definitely recommend bringing your own pillow. Um, I purchased a bathrobe, which I'm wearing right now. I went to Walmart. Sorry, still coughing a little bit. I went to Walmart the night before my surgery I wanted to get a long phone charger and a bathrobe and slippers. I wanted to get slippers my scar's itching. I wanted to get slippers that weren't slippery, um, that had some padding in them because those socks they give you at the hospital with the no grip stuff, they're just very thin socks, and I like nice, thick, warm socks, or so I thought maybe I'll get some slippers that I could just slip my feet into so I don't have to worry about reaching over and putting them around my foot. So I wanted to get something that my foot would just slip into and had a rubber bottom. Unfortunately, I didn't find that. And it was my last night. Like, I shouldn't have waited till the last minute. Um, because they did have some really nice memory foam slippers that felt so good on me, but they were too small. They had small and large, and the large were too floppy, and I didn't want to trip over them. So if I couldn't get a pair that fit right, I wasn't going to just get a pair that didn't fit and end up tripping or something. So I should have got slippers sooner. Let me see. The robe was nice because I don't know if it was my body's temperature or the ICU room I was in, but I just kept feeling cold and then hot and then cold and then hot. So the hospital had a sheet and a blanket on the bed, and then I also had my bathrobe with me. It's like a fleece blanket. I got a nice thick fleece one. So it was on the side of me. So if I started to feel cold, I could just pull it on me or take it off me. And it was a nice light robe. It's not like it's a big heavy blanket because you can't lift, you're not supposed to like lift heavy blankets and pull blankets up and stuff. So this was good. I would put it on the bed, and when I was sitting in the recliner, if I wanted it, I could just grab it and cover myself with it. So it worked well for that, and it also covers the back of the hospital gown when I would take my walks around the unit because they wanted you to walk all the time. So I liked wearing my robe when I did that. It just made me feel really cozy and comfortable. Um, the long phone charger, I went thinking that the biggest one I would get was 6 foot because that's all I've ever seen. And while I was at Walmart looking, there was actually a 10-foot phone charger. And I'm like, oh my gosh, I'm going to get that. And this was great because I could plug it in and keep it plugged in, and I could use it on the bed or just move it to the chair I was in. And it just was very long, and I didn't have to worry about reaching for my phone because I could always have it like right near my hand, wherever my hand was, with the nice long phone charger. And I have tips coming up about after this, what to bring. I think I'm going to make a video for just some tips, or maybe I'll put it at the end of this one. Um, Someone said dry shampoo and a comb or brush, and I do use dry shampoo at home sometimes, and I was like, oh, that's a great idea, because I know they're going to give you a sponge bath, but they probably won't wash your hair, and it just, when you feel sick, like feeling greasy and yucky on top of it doesn't help. So I don't know if guys would use dry shampoo, but I didn't I didn't care. I just didn't feel good and I didn't care what my hair looked like. But my last 2 days I was feeling really good, and so I cleaned my hair with the dry shampoo and I just felt so much better, and not like I was like sick in a hospital bed. Like it just gave me um a psychological, looking better, feeling better. It just lifted me up a little bit. Um Deodorant. I brought my own deodorant. They did have a roll-on deodorant at the hospital with this little bucket they gave me. But I wanted to bring my own deodorant because I get sweaty unless I use the certain deodorant that I use. And you also don't want to deal with if they give you a deodorant that you've never used before, and what if you're allergic to it or have some kind of reaction. So bring your own personal toiletries if if you're a girl and you need pads or tampons or something, bring your own, because they're not going to have the kind you like at the hospital. um oh, so also with the deodorant, they also gave me in my bag, or in the little tub they give you, um mouthwash, toothbrush, toothpaste, and hand lotion. Um, and I don't like slippery hand lotion. I like thicker. Like I use Gold Bond hand lotion, and I just love it. It's creamy and it feels good on my hands. Where if lotion is really watery, I just feel like my hands are just wet and I can't rub the lotion in. So I'm glad I brought my own lotion because the lotion did feel yucky. Um, and the toothpaste and toothbrush, I'm glad they hid in the bucket because that's something I forgot. Um, and unfortunately, the toothpaste was so gross. I had to use it though, and it was so gross. Um, so definitely get yourself a little tube of whatever toothpaste you like, because you don't want to be gagging on gross toothpaste. Um, I downloaded a quiet noise app to my phone called Sleep Pillow. It has the icon is a blue owl or something. And I use quiet noise at home ever since I had my baby. 8 years ago. Um, it just drowns out all the little beeps and noises, because if you're trying to sleep and all of a sudden something starts beeping, it's going to wake you up. But if you have this, excuse me, quiet noise app playing, turned up next to your ear, it just drowns all the other noises out, and it's always helped me sleep. Um, and it is noisy in the ICU. There's nurses talking to each other. You're so close to the nurse's station. You actually have, I had a nurse that was sitting in my room with me. So nurses would come by and discuss patients with her, and it was just constant noise. Um, and the quiet noise app I use, it has a choice. You could use like running water, or I used to have one that had like TV static, that static noise, and I loved it. But they have ones with, air conditioner noise or distant helicopter noise. And so download that to your phone if you have the ability to, and see what, if you like one, if it helps you sleep or whatever. Have that ahead of time. Um, Sleeping mask. I didn't think I'd be able to use a sleeping mask because I'm claustrophobic and I don't like things on my face or shutting me in like that. And I thought, well, I'll bring a sleeping mask just in case, because in the ICU the lights are always on. They don't turn the lights off because they're always around you. And it's really hard to sleep with bright exam lights on the room. And even later in my stay, the hospital room I was in, the wall to the hallway was all windows. So even if my lights were off, all the window light from the hallway was coming in. So, if you're not sure what your hospital room is going to look like, if it's going to be bright or whatever, the sleeping mask worked out very, very well. It definitely did. Also, make sure you pack your advance directive or your healthcare proxy, living will. Even if you already gave a copy of it to your surgeon's office, when you check in, they're going to ask for it. I had 3 different departments take my living will and scan it in. And I was thinking, can't you just get it from isn't on the computer system already? And everybody just wanted to scan it in themselves, I guess. So make sure you have that with you. A paper and pen. And this is something I didn't think to bring, but luckily my husband had brought it. When your breathing tube is in and you can't talk, but you're awake, there's going to be things that you want to say, you want to ask. So definitely bring a pen and a notepad for support so you can write down questions or sentences, and the nurse can know what you want. Like in my case, the breathing tube was very pliable, and I didn't have the strength or whatever, or I would fall asleep and I couldn't hold my mouth open. So my mouth was actually, my teeth were clenching on the tube, which was then cutting off the air. So then I would wake up again. So I wrote to the nurse, I keep biting down on my tube and it's kinking it. And she's like, oh, well, don't bite it. But things like that, like I don't think she realized that was happening. And I needed to get that information to her. So you'll be awake with your tube in. They won't take it out while you're sleeping, so you will be awake and alert and still have the tube in for a little while. Mine ended up staying in for 2 hours after I woke up because my oxygen levels were low. So I was awake and alert, and I didn't mind it being in, and that's in another video, but definitely bring a notepad and paper. I also, with that notepad and pen, wrote my son a note that morning of the surgery in case something went wrong, so someone could deliver that note to him. Someone said bring chapstick because hospital rooms are always dry. I didn't have that experience, and I usually don't use any lip balm, but because people said, I did bring it, and I ended up not using it. But if you're someone that uses it, I guess definitely bring it. I wrote down Puffs Plus. I love Puffs Plus with aloe. I have constant allergies, my son and I, and I'm picky about my tissue. And when you're not, you're going to have a lot of mucus going on. And the tissues they have are like newspaper. They're not soft and cushy, and so definitely bring your own tissues. If I had to do over, I would, because I went through like 2 boxes of their rough sandpaper tissues. Okay. All right, that's it for what to pack in the bag. I'm going to make a separate video for things to do at home to prepare for coming home, and another video about just some tips that I picked up while I was in there. All right, thanks.